Hello, and today's Wellness Woman feature is Dr. April Soto M.D. She is a dear friend of mine, a longtime client. I've been working with her for around probably 5 years-ish, or maybe more. And she just started her own private practice. She does Biofield medicine, energy healing, direct primary care, integrative medicine, and psychedelic medicine. April, thank you so much for talking with us today, letting us know your story and everything that you do.
Thank you, Louisa. I am over the moon to be here, and I've been over the moon to meet you. Shout out to Denise Woods, who, when I said I need somebody who does Pilates, Denise Woods at Denise Woods Yoga is like, I got the person for you. And I'm very thankful for that.
Yes, thank you, Denise.
Yes, so thankful for that. And I can definitely start out with my origin story. How did I come to be where I am, and how did I come to be who I am?
Absolutely. Yes, please. We would like to know, what got you into medicine in the first place?
And I would also like to honor and thank you for sharing time and space with me. This means a lot to me.
Oh, thank you. Thank you.
Yay.
Likewise.
And thank you, because the years that we have worked together, you have helped me heal, and you have helped me find the different aspects of myself so that I can do what I'm doing today. You are a big part of that, and I thank you.
Thank you, April.
Yay.
Thanks so much. I'm so honored.
It's so true. It's so true. It's so true. I would not be me without you, because community is medicine. Community is the medicine. We are the medicine for each other. And you have been
Absolutely.
medicine for me. Yes.
Yeah.
Yes.
And same. I feel exactly the same about you, like tenfold.
Thank you. Thank you. So I'm blessed to, I'm of Puerto Rican descent, but I was born in Guatemala because my parents were missionaries there. And I grew up experiencing chronic illness in my own earthly form. And it was difficult because while there's excellent physicians in Guatemala and all over the world, there was not as many resources. So it was challenging. And then we would drive by the Cruz Roja, the Red Cross, and there would be no medicines in there. And we would, medical teams would come from the US to Guatemala, and I would help them administer medicines to the villages and things like that. But I just noticed that there was not a lot of continuity of care. I was 15 years old, translating, giving shots to the doctor so that they could give them. And I just really became really fascinated with how to communicate with another human so that we can support them in finding their healing. And so being blessed with the experience of chronic illness in my own earthly form was very challenging. And I'm grateful that I have survived it. And I believe that the same mind that co-manifested illness is the same mind that I can use to co-create health. But this illness served me because it kept me safe in many ways, because I had quite a traumatic childhood. And I am not necessarily thankful for the trauma. I am thankful that I survived it. And I am thankful for all the skills and the internal parts of myself that helped me survive that. And because of all that, I really have become interested in medicine. And medicine brings me great joy because it's a way of interacting with other human beings on a very, very special level. I feel privileged and honored to have that communication. And so in healing myself, I have learned some basic tenets or some basic principles that help me support other people healing themselves. Because my number one philosophy is I come to work and get out of the way, because it is my belief that I facilitate and witness another human being connecting with their own inner healer. And so it's a beautiful way of us interacting. I don't believe I'm a healer of one. I don't believe I necessarily heal someone else. And that's very empowering, because everything my patients have, they already have within them, just like everything I need, I have within me. It's about connecting and unlocking that.
Beautiful. I love when you say that, because I do feel like, yeah, it's true. Like you are very adamant that you're like a facilitator, you're holding space, you're creating a safe space for healing to happen. but
Mhm.
that, yeah, like taking the ego out of it, being like,
Mhm.
I'm a healer,
Yes,
I heal,
yes,
people.
absolutely. I've healed a person, I've healed myself with
Mm-hmm.
the spirit and source. And it's beautiful to sit before humans that are transforming and healing themselves. So
Mm,
it's a beautiful way of taking ego, which we needed. It's not a bad thing, but I put it aside because if that becomes between me and my patient, it impacts healing in a way that I would rather it not.
yeah.
And so it's really beautiful to sit before someone. And so, yeah, I believe I'm a medicine woman.
Mm-hmm.
I do identify as female. And I believe that I'm a facilitator and a witness. And so, what's beautiful is there's just different tools. There's different tools that we can use to help someone. I totally believe in science. Science is just truth, gravity. We are standing on Mother Earth because of gravity. So I
Mm-hmm.
believe in science. There are some properties of the physical realm in which we live that are very important that we can use to our advantage, that we can work with. While there's also, we are, I believe, spiritual beings having an earthly experience, and we are still energy. And we can measure that energy. It's proven. We put electrodes on the body and we can see the electric energy of the heart. It's called an EKG, so we can see the electricity of the heart. So we are all
Absolutely.
energy, right?
Mm-hmm.
And we can work with that. It's just what's interesting is in the Western world, we've really focused on the physical realm, which is not wrong. It's just we have dissociated
Mm.
the physical from the spiritual. And in my practice, I'm wanting to bring it together.
Oh, beautiful. That's why I am so excited about you and your practice. And having, like, when I first met you, you were
Yes,
working, in a big corporation
yes,
in
yes.
the system, and then watching you blossom into what you're doing now and having your own private practice. I feel like in just, a short time, you have I feel like you having creative freedom has just, like, you've really stepped into yourself as a medicine woman and a healing facilitator.
Oh,
Yeah.
thank you.
Yeah.
That means a lot. Yeah. I'm so thankful for having the experience of working in corporate medicine for 15 years. I'm really thankful for that. I honed my craft. I got to learn so many things, and I when I left that job, I left it in love. And I
Mhm.
left all those who still inhabit that realm with love.
Yeah.
I just also, my resignation letter was a love letter to myself because I would like to find the creativity that is within me. And so what's beautiful is now my employer is the light. Spirit is my boss.
Mm-hmm.
And what we do together with reverence and respect is we create conditions for folks to heal and shine. That is what we do. And we co create those together with my patients. And I
Mm-hmm.
have patients of all walks of life. I'm really grateful for that. I have a diverse crowd, which makes me very happy because diversity is really important for us to see life through the eyes of another.
Mm-hmm.
That makes me very happy and grateful. And
Yeah.
we honor the First Nations who came before us because they have been doing these medicines for millennia. And I honor them, all of the First Nations around the world.
Mm-hmm.
And I honor the First Nation within me, which is the Taino indigenous people from Puerto Rico that exists within me as well. And
Mm-hmm.
they were decimated by colonization. And so I also believe in decolonizing myself, and I have done that. And I support my patients decolonizing themselves. And the first place in which we have been colonized is our mind and our beliefs. And
Mm-hmm.
so letting go of those beliefs that served me but no longer do. And so that's the medicine I practice.
Beautiful. Beautiful, April. Thank you for sharing that. Um, I'd like to dive deeper
Yes,
into the things that you do, like
yes,
the
yes,
the um they're not experiences, but
yes,
kind of, they
yes,
are
yes.
experiences that you offer or
Thank you.
modalities that you offer. And one is, I really like the word biofield medicine.
Yes.
Yeah. Can you explain a little bit more about what that means?
Yes. So Biofield medicine is a new but very old type of medicine. Again, talking about our ancestors and the First Nations who around the world, they understood biomedicine long before any of us were even imaginations.
Mm,
And so we honor them. And so we are all electricity, we are all energy. And how can we work with that? So an example of biofield medicine is Reiki,
mhm,
which we honor our Japanese folks who discovered that.
mhm.
And there's different types of working with energy. And each one is just a tool and a
Yeah.
consciousness. And so we don't have to subscribe to one particular one. I have had some Reiki training, which is really interesting. And the most important training of all that I have done is my own work on myself.
Yeah.
Yeah. And so what's beautiful is I use sound and I use the massage gun that you taught me how to use because of you. I was like, I want to do that. And so I use that with my patients. And then we can also use intuition. And
Mm,
we can also use the most important energy of all is love. And
mm,
so with using the modality of sound, with using the modality of abdominal massage with essential oils, with using the modality of speaking, of singing, of moving energy with those primal sounds that can come out of me, I
mm.
have helped me move energy. And
Yeah.
what's important about that is that it's a beautiful connection with my patients that are on my exam table. While we're moving energy together and we are connecting together in order to find the healing. And the way, in my humble opinion and my experience, to work with energy is to allow rather than to harness. So
Yeah.
I work with energy by allowing it.
Mm. Ooh, I like that. Yeah.
And
Uh,
so I work with that for the biofield, and that's how I utilize that. And it's very much about working together with my patients.
yeah. I love that. And I love that you had that analogy of the EKG because
Yes.
a lot of people, if you hear energy work,
Yes.
some people are, kind of like, oh, that's not a real thing,
Uh-huh.
but it is a real thing. And you
Absolutely.
can, you know, uh, you can measure frequency, you can measure
Yes.
energy
Yes.
off of
Yes.
every person.
Yes.
Yeah, I love that I feel like the term biofield medicine just gives it a little more validation if it needs that, and like creating a more like tangible, that it is
Mhm.
something tangible that can be worked with
Yes.
and is important.
Yes.
Um,
Yes.
so I think that also falls into energy healing.
Yes. Yes. Mhm.
But then I also would love to hear more about the direct primary care, because that's probably a little more along the lines of traditional
Yes. Yes.
Western,
Yeah.
right?
Yeah, and it's very beautiful because in my primary care practice, I'm able to bring into it a lot of different tools. That's all they are, is different tools to work with. Like some type of food requires a knife and some type of food requires a spoon. I could not easily eat pho with a knife, but with a spoon and fork, that can be very useful. And so different tools can be assigned to different needs, and that's a beautiful thing. And so direct primary care is a really beautiful way of having nothing between me and my patients. And so I'm a family doc, I'm a family physician, board certified. I'm also trained in taking care of people who happen to live with HIV/AIDS.
Mhm.
And so, yeah, and I've done that for many, many years, 15, 16 years. I've been able to practice that type of medicine. And so I bring that in. So if folks want to talk about cholesterol, let's do it. Let's order labs. Um, Folks need a particular type of medicine, let's do that. We can do that. Gut health is a very, very important aspect to my practice
Mhm.
because the gut is very important for the rest of our health. The
Mhm.
gut holds about 70% of our immune system, and the gut has been called our second brain. And we oftentimes say, God, I felt that in my gut. Felt like I punched in my gut. I didn't listen to my gut, or I did listen to my gut. And
Right.
it's really primal to us. And so we can work on it in the physical realm and the primary care. Like we can do studies to see if there's any infections. We can look at different dietary practices because food is medicine and medicine is food.
Mhm.
And then we also look at it on the energetic because a lot of us have had to swallow and digest things that we should have never had to deal with. And
Mhm.
it can stay in our gut and our tissues. And so with the biofield medicine, I, with permission, massage the abdomen with jojoba oil and the essential oil of folks' choice.
Mhm.
And we can move energy that way because just because the stress is gone, does the stressor is gone doesn't mean the stress is relieved. So we can
Right.
have a stressor with trauma and that stressor can be gone, but the stress still remains in our body unless we complete the cycle. And there's different ways to do that.
Mhm.
So I practice primary care. I do pap smears and psychedelics in the same room, honey.
Yes.
So
Yes.
I deal with
Mhm.
anatomy that happens to be internal reproductive organs. I
Mhm.
also deal with external reproductive organs because I have patients who happen to be men who happen to have vaginas.
Mhm.
I have patients who happen to be women who happen to have penises. So I'm very specific about the terminology that I use uh, because male and female is just about how my patients identify. I do not assign them a sex. They tell me.
Right.
Uh, and so I'm able to practice that type of medicine and
Yeah.
support people in their health with that. I'm very fascinated with medical mysteries. I feel very sad when people have to suffer or
Mhm.
have suffered, but I very much enjoy sitting with somebody because if we listen to our patients long enough, they will tell us the answer. And if we listen even longer, they will tell us the answer as to what the treatment is. So
Yeah.
it's about sitting before somebody and listening.
Yeah.
So I enjoy the director of primary care because it's a subscription model,
Mhm.
flat fee once a month. That includes texting, calling. Folks can come in and see me, or we can text or we can call, and that's all included in the flat fee. If they want additional services, that's additional, but the
Mm.
flat fee covers most of what they need. And
Yeah.
that's beautiful because there's no insurance between my patients and I, so I can spend more time. And one of the things that I'm doing in my direct primary care practice is I'm doing walking visits. So last Thursday, I did a walk around the Rose Bowl for a medical visit for one of my patients, and we talked about his health and well being and enjoyed the sunshine. And so I'm starting to offer that service. And I'll probably meet folks
That.
at like 7 or 8 a.m. Let's walk the Rose Bowl. I'll probably do 2 in the morning. Let's walk it. And it's good for my exercise and it's good for my patients. And then we can get out in sunshine. It can be, let's discuss your concerns and your questions in a relaxed way. And I'll take my medical bag and I'll probably check vitals on the back of my trunk. And let's go for a nice walk and let's really be in communion with nature because
Oh,
that is how we heal.
it's incredible. It's almost like the term like medical coach came to my head.
Yes.
No, like
Yes.
if you were
Yes.
like personal trainer, but
Yes.
you're like a
Yes. Yes.
medical trainer.
Yes. Yes.
I love that. I love that. I saw that your latest post on your Instagram
Yes.
page,
Yes.
and I'm like, yes, look at her
Yeah.
continuing to blossom and creativity.
Fun. Thank
And then,
you.
so the last one, so that kind of you've covered like the integrative medicine part too.
Uh-huh. Yeah.
And then the last one I would like to talk with you about is the psychedelic
Yes,
medicine
yes,
you.
yes. Thank you. That's really exciting. So, yeah, integrative medicine just means we draw upon different beliefs and different support systems that work best for the patients according to the patient beliefs, patient ideals, and aligns best with the patient's consciousness.
Mm,
And so I am also board certified in integrative medicine. And one of the last courses I took in integrative medicine, my 2 year fellowship that I just completed last year,
mm,
was psychedelics. And what's interesting is I had been offered the opportunity to experience healing myself with psychedelics. And I have been doing that since the beginning of the pandemic. And I really went to an intensive place of me really wanting to heal
mhm,
and transformation happened. And I'm very thankful to my therapist because she has really facilitated and witnessed me in healing. And
mm,
so I was already working on that myself. And then comes the course of psychedelic treatments. in
Yeah.
my integrative medicine fellowship. And what's beautiful is it was just a really nice way of understanding the science behind it and also experiencing it, because I believe that I walk the walk and talk the talk. If I recommend a patient do something, I will do my best to get as close to how I can heal myself in that arena so that I can really be present with somebody. And the greatest training, I believe, for me to have practiced psychedelic treatment for folks is my own work.
Right.
And so, yeah, right. And
Yeah.
so, MDMA, I am trained in, and that is expected to be FDA approved. We're thankful to the MAPS organization that is expected to be approved in maybe 2024, FDA approved, and we're thankful for them. We're also thankful to the First Nations who understood this
Mm.
type of consciousness for millennia. They
Yeah.
work with plant medicine. Um, but what is legal at this time is ketamine and breath work.
Mm.
And psilocybin is decriminalized, and I have some great therapists that work with that if folks are interested in that. I only work with something that has been given permission, and Spirit has not yet given me permission to experience psilocybin, and I'm very, very careful about only doing what I'm given permission,
Yeah.
because it's very important to honor and have reverence for this. And so the agent I work with is ketamine and also breath work. And
Mm-hmm.
so what's beautiful is ketamine is a anesthetic, but at lower doses is a psychedelic, which means we can go into a dreamlike state. And
Mm.
what's beautiful is the way that it works with our brain properties is that it can decrease our hypervigilance. That can be a very salient feature. It can be a predominant feature in folks who've had trauma and PTSD. We have this hypervigilance because we're always looking around to see how we're going to keep ourselves safe. And that has kept us safe. But in the long run, it can really, really be difficult on our sympathetic nervous system to be constantly on, which can cause
Yes.
fatigue and can cause different, right, on the physical plane, it can cause a lot of biochemicals to rise up that are inflammatory, and it can cause challenges for us. But we don't know anything different because it's what's kept us safe in these very difficult situations. That's an example of the stressor being gone, maybe, but the stress still being present
Yes.
because our internal parts
Have been
learn that,
programmed that way,
yes,
right?
this
In an
is the
early
way.
age. Yeah.
Yes. And so talk therapy is very important, but it only is part of the puzzle. And so with these medicines, it can lower our defenses, so to speak, by working with different aspects of our brains,
Mm-hmm.
lower our defenses so that we can be present in a way that is different than what we've ever experienced. This can be reached in meditation, this can be reached in breath work, this can be reached in different ways. But what's nice about this is in a very safe environment. I have my AED, my automated external defibrillator there, my EpiPen. Um, I have it in as controlled an environment that is safe on the physical plane. I
Mm-hmm.
do medical evaluation for folks, and then they come in and we check vitals. And then either we do the oral medicine and folks swish for 12 minutes because it's absorbed through the buccal mucosa, which is the inside of the cheek, and spit out. And then folks can lay back if they want. They can sit up if they want. And we schedule about 3 hours because the person goes within. And I just sit there on my meditation bench so that I can make sure that there's a safe space. If so that your earthly form is protected.
Mm-hmm.
And we have consent around touch about the shoulder and the hand or the feet if you need to go to the restroom. But I do not interact with someone's earthly form outside of those confines other than to keep someone safe,
Yeah.
because the person is in an altered state, and safety is a really big, safety and consent are very important to me.
Yes.
And what's beautiful is that we let go of expectations because every journey is different, including in each person. And every piece of this journey isn't always sunshine and flowers. Sometimes, for me personally, I've had to look at things that happened to me that I had buried and hidden. But
Mm-hmm.
each journey, I had more spiritual muscles in order to be able to look at that
Yeah.
with the complete understanding that I am cherished and loved no matter what. And
Yes.
that is the safety in that.
Yes.
And so that is how I practice psychedelics. And so I work with therapists so that folks can integrate, which just means making ourselves whole because we have different fragmented parts of us. When we
Yeah.
say, God, part of me wants to do that, but another part of me wants to do the other, we have different parts inside. And so if we can come to make ourselves whole, and we do that ourselves. And so integration is super important. And I practice what I preach. I talk to my therapist once a week,
Mhm.
sometimes twice, in order to connect with myself. And that is how to practice. But if some folks have had so much trauma with the therapy world, then I will still work with them. I just ask them to be mindful and deliberate and thoughtful in integrating. Journaling, walking, being in nature, being present with emotions, because emotions are neither bad nor good. There can be unpleasant or pleasant, but they are very important energies that give us information and help us connect. We incarnated so that we can experience emotions and we can experience. And so, how do we sit with anger? Oh, that anger's coming up. Oh, this sadness is coming up, but not sending away anything, any emotion that comes up, but just rather inviting it in for a cup of tea, no matter how difficult it is. Being comfortable with discomfort is the greatest spiritual muscle of all, because that is where the healing is. Because working with energy is about
Yes.
and being
And I
present.
love that you use the words muscle.
Yes.
It's true. In my own healing journey that I've been on for the past 15 years, I feel
Yes.
like when you first start, it's like asking somebody to do a full push-up.
Yeah.
Like you have to do little baby steps.
Yes.
And the more like ingest and process and understand and realize, the more I feel like the stronger, maybe it's the word is like more flexible your nervous
Ah,
system
that's
becomes,
right.
right? So it's not about creating the perfect environment around you so you can stay, calm. It's about being able to ebb and flow with
That's
life.
right.
And yeah.
That's
And like I think the most important part is letting go of stuck energy and
yeah.
stuck things that need to be processed and that are old, right? That don't serve our purpose anymore.
That's
And
right.
yeah, then we can handle the new stuff that comes our way.
That's right. And I will say that that process, we speak about that a lot in pop culture, whatever. Let's just let go. Well, that act of letting go is no joke, honey. That is
Mhm.
like
Yeah.
energy that's stuck, doesn't necessarily want to leave.
Mm.
We have believed that it's kept us safe, and in many ways it has served us. So these things that have no longer served me, I sit with it and I honor it and I acknowledge it,
Mm-hmm.
because it is what kept me safe. And
Mm-hmm.
so the idea of letting go isn't just rainbows and butterflies. It has required moving through it and making sounds and noise and chortles and grunts and being on all fours and squinting and being like, okay, psyche, can you turn it down a little bit so that I can sit with this?
Yeah.
And so the act of letting go can be, woo, it can be quite a profoundly challenging experience.
Yes.
But what's on the other side of that and what's on the inside of that is love and light. And so that whole muscle, that whole act is no joke. And some of that I've done on my own shadow work. And what is shadow work? It's just that from which we are disconnected. And that shadow can govern our behavior,
Mhm.
whether we know it or not. It's impacting our behavior. And when we look at it from the lens of what happened to you rather than what's wrong with you, what
Yes.
happened to you, we understand, okay, this serves its purpose. So when I come and I'm with somebody who might have behaviors that are challenging to their earthly and mental form, rather than be, well, that's not good. You
Yeah.
know, that crystal meth is really hurting you. Instead of that, I
Mm.
think, how has this served you?
Right.
And
Yeah.
what a strong person you are that you've been able to learn how to navigate the world. And this does have its purpose. I just wonder if we can look at it, be present with it, not judge ourselves for it, but remain with one thing. I have two main qualities that I come to work with, is curiosity and love.
Mm-hmm.
And how can we transform this, because energy is neither created nor destroyed, it's just changed in form. What can we do with this? And
Yeah.
so letting go can be quite a challenging act that takes the rest of our lives.
Mm,
But in allowing that and being present with that, that is how we can start to transform. And it is my privilege to sit before people in doing that. And it can take as little or as long as it needs. And it's really profoundly beautiful to
mhm.
see folks really connecting with the inner healer themselves. And
Yeah.
that's how my approach is.
Oh, beautifully said. You are so articulate. I love,
So,
yeah, and we talk about this stuff all the time. It's
yes.
so beautiful though to hear you put it all together in this like really nice, 30 minutes of
Well,
time.
thank you.
And
Thank you.
I would like to say that I have had my own experience with April in healing. I have done a psychedelic ketamine journey with April, in which I I prepared for it for about a month,
Yes.
um,
Mhm.
with her help and just with all the like tools that I've gathered in my toolbox, in the last however many years I've been gathering tools. Um, and then the experience itself was absolutely life changing. And yes, it is so beautiful because I am hyper vigilant and I've always had to be. I overthink things and I'm always anticipating, and I've gotten better over the years, but there's still like a residual piece that just like is programmed that way. And that was one of my
Mhm.
main intentions with the journey. And you are absolutely right. Like it does quiet all that down. And I was able to see so clearly
Mhm.
um the
Mhm.
truth, which is
Yes.
force, like that
Yes.
thing that's bigger than us,
Yes.
right here, there, it's here.
Yes.
It's,
Yes.
all the things we search for are really truly here,
Yes. Yes.
out there.
Yes.
And I'd like to say too that it's like the ketamine itself is a piece,
Yes.
right? But I think it's important for people to know that like it's not a thing that takes your troubles away.
No.
It's just a tool,
Mhm.
like a very intense meditation tool, I would
Mhm.
describe it, you know.
Mhm.
So a lot of work has to be done before and
Mhm.
after.
Mhm.
And that little piece though gives you a little glimpse. It's like if you're inside of a
Mhm.
struggle with somebody, right? Like in drama, and you're
Mhm.
inside of it, you cannot see the reality of what's going on because you're wrapped up in it. But when you take a step back and you're looking from a bird's eye view, all of a sudden, like things are a lot clearer and make a lot more sense. And
That's
a
right.
lot of the little things you thought were a big deal really are not
That's
at
right.
all. Like, don't
That's
even
right.
matter. There's a lot we can shed
That's
that
right.
that really doesn't matter.
Mhm.
So I just wanted to add that, my little experience, it
Thank
was a big
you.
experience. It was
Ah.
amazing. And I've also done the sound bath and gua
Yes.
sha treatment with
Yes. Oh, yes.
you. And that was amazing too. And I was able to connect kind of in the same way that I did
Yes.
with the
Yes.
ketamine journey, but totally
Yes.
sober. And
Yes.
do make noise, like you sing, and it was just so beautiful and lovely to be sung to. Like I felt like a little baby that was like at a bath, and then
Oh,
you're rubbing the oils. Like I felt very cared for and
I
like
love
loved,
that.
all the
Oh,
time. When I'm around, just in your presence, I always feel loved,
oh,
cared
thank
for. But
you.
yeah, so I can vouch for
You.
April's journey, April's offerings personally because I've experienced them. And yeah, you're just an incredible person.
Thank
Thank
you.
you so much
Thank
for
you.
sharing your information with us. How can people find you if they want to work with you?
Yes, and I also want to acknowledge that you're an incredible holistic Pilates instructor. unlike any other, because I've had quite spiritual experiences on your Cadillac. Thank you very much. And you know, you've watched me have some unfolding on your tables too, and I
Beautiful.
want to acknowledge that.
Thank you.
The way folks can find me is www.lalimhealth.com. Lalim stands for Love and Light Integrative Medicine, LALIM, Health, HEALTH, Lalim Health, all one word, .com.
Excellent. And I will also put it in the description.
Thank you.
And, you know, share it so everybody can find you. But thank you so much.
Thank you.
It's a pleasure. It's a pleasure watching your journey too. Like your
Thank
own
you.
healing journey.
Yes,
I mean,
own
I've seen
journey.
a dramatic change in just your energy shift, you know.
Thank you.
But one thing that I always learn from you is gratitude. Every time you come into my studio, you know, and I'm like, how are you doing? You're always like, I'm grateful.
Mhm.
I'm grateful. And you're grateful when shit has hit the fan.
Yes.
You're like, I have
Yes.
been presented with many opportunities to learn.
Oh, yes.
And I'm like, oh, okay, I hear you, you know. But just like having that frame of mind where, you know, you can learn in the bad times, and you know, and
Yes.
of course it's easy to be grateful when things are going great. But thank you so much, April. And yeah, don't hesitate to reach out to April or myself if you have any questions. Thank you for watching.
Thank you.